Welcome back to Winning Isn't Easy. Hunter, I've learned a lot during the first part of our podcast, but I've got lots of other questions that I want to ask, and I know that my clients would be wanting to get answers from. So tell us, what are the three common questions that you get? And then I'm going to ask you, what are the three common questions that people don't ask you, but they should be asking you? So let's start out with, what are the common questions you get?
I think the most common question I get is, do I have to wait for annual enrollment to change my plan? And there's a lot of different election periods out there that people are unaware of. There's election periods for if you've moved, and one of the biggest ones is a chronic condition. If you've just, so take, for example, maybe whenever you signed up for a plan back a year or two ago, all of a sudden you found out that you have high blood sugar or high blood pressure, and it's kind of a new thing for you, a new onset disease or condition that you have. That opens up a election period for you also. There's certain plans are called chronic special needs plans, and that opens up an election period throughout the year, and you don't have to wait for that annual enrollment period.
I have a question. So when you say there's an election period, let's say I was just diagnosed with high blood pressure. Do I have to enroll in this? Can I enroll in a change program immediately, or is there a time limit that I have to do it in like 90 days or I lose my opportunity?
So let me see. So with the chronic conditions, no, you don't have to change right away. A lot of the times you may want to at least look into it, because there's times where the prescriptions, I know some of the medications that they have for these chronic conditions, they can get expensive. Mm-hmm. So those plans get more funding, so they're able to help save some money on your prescription costs. And a lot of times they'll bring in lower copays, things like that. So you don't have to change, and there's no timeline for it. It's just if you have a new chronic condition, it's definitely something to consider. And that election period allows you to change if you do determine that that's something that you want to do.
Great. So you gave me one common question. What are the other two that you get?
Other two, I think one of my favorite ones I always hear is, why do I get so many phone calls from insurance agents? And I know for me, you won't get a phone call from me if we haven't met face to face, or you haven't reached out to me. Maybe you got my business card or a flyer or something. We have limitations where we have to have scope of appointments. We're not allowed to reach out to you without permission from you. Another thing is, with people call into these commercials, then a lot of the times they put you down on a call list, and you start getting phone calls from marketing people trying to get you to look into, oh, look at this benefit. They'll continually call you. I've been in appointments before where I've had the lady sitting in front of me get 10 phone calls.
Oh my goodness.
Sitting there, and she's like, I just don't answer them anymore. Her phone just constantly going off. I felt pretty bad, because that is just it's very frustrating and annoying when your phone's going off like that.
It is. So are there any other common questions that we want to cover that you get before I ask you the questions that they should be asking you, but they aren't?
I guess the other one is just, they see the commercials and they ask if they qualify for the food cards or the extra benefits on top of it, utility help, things like that. A lot of those have to deal with your dual plans. So that's having Medicare and Medicaid. And then some of the chronic special needs plans, some of those give you a small allowance. That would be the third most common question that I hear.
So as I have teased, what I want to know is, what are the questions that you wish people would ask, but they don't?
I think my big thing is just ask the questions. ask the questions that you're not sure about. Um, any question's a good question to me, because that makes me know that you're willing to look at the different options to see if there's places that you can save money. The one I would say that people need to ask more often is, are my doctors in network? Are my prescriptions covered? I think a lot of people out there, they'll just overlook the prescriptions, but you don't realize how big of a difference going company to company that the prescription costs can change up and down those tier levels.
Okay. So should individuals reconsider their coverage every year, or, I bought a policy a year ago, 2 years ago, it's fine, and I don't have time to pay attention to it. If something's wrong, somebody will let me know. What's the answer to that?
Definitely look into your coverage annually. A lot of the times, even if it's within the same company, these companies roll out new HMOs, they roll out new PPOs to where the older plans, they may not cut them off to where you still have your old plan, you still have coverage, but that may be a outdated plan where there's another plan out there that is going to save you in your max out of pocket, save you in your copays, and just add more benefits on top of what you've already had.
So it's nice to get a tune-up or a checkup, but you don't necessarily have to change. But, it's sort of like getting your annual physical, right?
It is. You want to make sure that there's not an upgrade out there you're missing out on.
Great. And when a person approaches you and says, I want you to look at what I've gotten and tell me if there's anything new or better, is that any different than the original process that they've gone through to say, hey, I want to enroll in something, or is it the same process?
A lot of it's the same, but at the same time, I always ask those questions about the network, because if you're staying local and you're not traveling a whole bunch, and there may be a local plan that's going to lower your costs tremendously.
Well, certainly one incentive to do this annually, as you said, is if a person has been diagnosed with a new chronic condition, or maybe perhaps the prescription that they're taking is increased in price. Would that be right?
Yes, ma'am. Yeah, you never, as you age, get older, there's always new conditions. I mean, whenever you go to the doctor, you want to have a good doctor that checks in on you, kicks the tires a little bit, make sure that they're keeping you healthy, because that's going to make you happier. It's going to keep you active. So it's good to always check in with your doctor, make sure that they're checking you out, making sure you're staying healthy. And the health insurance plan can help you save money as you're getting all that done.
Great. So what are the 3 tips that you would have for our audience about how to choose a plan that's right for them, that meets their needs?
The first one I would say is, if you're new to Medicare and you're during they call the ICEP, it's your initial coverage enrollment period. That is a chance where you can look at supplements and you don't have to go through the underwriting. There's a guaranteed issue at that point to where you can buy into it. And it's only during that 7-month period that you're able to look at those and rule out, no matter if you've got a chronic condition or a health problem, they are not allowed to turn you away at that point. So that is one of the biggest things. If you're new to Medicare, make sure you at least know about those, ask the questions about it, because it's a good opportunity for you to at least consider it.
So before we move on to the other 2 tips, can you explain what a supplemental policy is?
So supplemental policies, those are plans where you don't have a network of doctors, like the Advantage plans. These are typically plans that you can see any doctor that accepts Medicare, and that's throughout the country. And it's typically a higher premium that you're paying up front. And depending on which plan you go with, there's set limits on how much you're going to spend.
Okay. And so, what are the other two tips for choosing a plan that you would share with our audience?
The other tip is, I think I've gone over it a couple times. Where do you seek your routine care at? If it's local, definitely take a look at your local plans, see if there's one that has your doctors, and that way, or doctors and prescriptions, and that way you can see if there's a plan that's going to help you save some money. And if you're a traveler, you like to go all throughout the country, then look into those other plans, make sure you have that coverage wherever you go. And even with the local plans, if you travel, you're still going to have emergency room care and you have urgent care throughout the country and worldwide.
So, give us a couple tips in closing as to how to find an agent like you who is really interested in helping me meet my personal needs and just isn't interested in the commission that you might earn.
Well, I'm always here if y'all need to reach out to me. Make sure that y'all see which companies they represent. Captive agents, they are there, which not saying there's anything wrong with it, but they have a set amount of plans, and not every plan is suited for everybody, doesn't fit everybody. So finding a broker that's contracted with several companies, that really helps you expand your options and make sure that you're not missing out on something. So that way, whenever you have the TV turned on and you do see the commercials, you're like, I know I'm good, and it doesn't raise those questions. And have somebody that you can reach out to, that you can get a hold of.
Mm-hmm. Well, I think you made a good point. My dad's family had an independent insurance brokerage firm in Baltimore when I was growing up. And he wasn't a captive. In other words, he wasn't just an agent for Nationwide. He wasn't just an agent for Allstate. And the same holds true here in the healthcare world, correct? You as an independent agent are going to represent a number of carriers or plans and be able to offer that smorgasbord to your clients. Is that correct?
Correct. Yes, ma'am.
And is there a typical, for an independent agent, the number of carriers that they might deal with, as opposed to, I'm a captive agent for, United, for example. But as an independent, I might represent 3, 4, 5. I mean, how many is it common for an independent agent to represent?
So it really can just range. Every state has different companies in them. You have a few carriers. So I'd probably say 4, 5, 6 carriers that are probably throughout the United States. And you'd probably do good to have just those. But depending on which state you're in, down here, there's a little over maybe even a little bit more, over a dozen different companies that you can pick and choose from.
Is there any kind of rating agency that somebody needs to be aware of that rates these particular carriers so that, when I would be talking to you, I would know that this particular carrier's got a C rating, and while the price might be good, it's a C company and I really want an A company?
So I know Medicare.gov, they have a lot of information on their website. Healthcare.gov, I believe it was Medicare.gov, that you can go through and see star ratings and all the different ratings. And actually, you can see all the different plans on there too. That's a great resource to look into. And that's where I would start if I was looking to see the full range of it per state.
Well, I know the whole process is confusing, which is why we refer our clients to you. And of course, we don't get a commission for that. We don't get any kind of kickback or commission or any kind of payment. We recommend Hunter because of the skill that he has and the great working relationship he has with our clients. If anybody wanted to contact you to learn more about the Medicare policies, or to even talk with you about their particular situation, how would they get a hold of you?
So I've got my phone number. I have a 1-800 number. It's 1-833-VOL plan, VOL. And then my email is hunter@volhealth.com.
All right. And could you spell that out for us, please?
So Hunter, HUNTER .VOL, like the volunteer state,
Ah,
HEALTH, health.com.
that we know where Hunter is from.
Yes, ma'am.
All right. Well, I thank you for your time today. And again, I thank you for the great work that you do for our clients, and the great work that you do in the community, particularly here in Pasco County in Florida. Thanks.
Yes, ma'am. Thank you so much for having me today.
Our pleasure.